Doctor, thanks for joining us today. Our topic is pulmonary embolism, a term a lot of people might not be familiar with. So let's start off right off. What is a pulmonary embolism?
Well, embolism means that something has traveled into an artery and has blocked it off, something that shouldn't be there. And pulmonary, of course, refers to the lung. So here we're talking about something that's traveled to one of the arteries in the lung and has blocked it off. There's several kinds of materials that can do that, but the most common one is a blood clot, which is formed in another place in the vascular system and then has traveled and gone to an artery in the lung.
Well, who's at risk for pulmonary embolism, and is there any family history component?
There are some families that are predisposed to having blood clots, but any condition that leads to a blood clot forming can lead to pulmonary embolism. The most common thing is immobilization, for instance, particularly in patients who are having surgery, and so they're laying on the surgical table for a certain length of time, and they can develop a blood clot, usually in the legs, and then later it can break loose from the leg, travel to the heart, and then be sent into the lung.
Well, this may be a related question. How common is pulmonary embolism, and how likely are you to suffer?
Well, it's not a rare condition. It's fairly common. It's been estimated in the past that there were about 600,000 cases of pulmonary embolism in the United States in a year. I think that we've done a lot of things to prevent those from occurring now, and so they're not nearly as common as they were in the past.
What are the signs or symptoms, if any, of pulmonary embolism?
Well, if the clot is large enough, the main symptoms can be shortness of breath, fast heartbeat, you can develop sharp pain in your chest, and you can cough up blood. But in many cases, pulmonary embolism doesn't cause any symptoms at all.
How serious is pulmonary embolism?
Well, there's a wide range of seriousness. It can be something that's minor that doesn't cause any problem at all the way to being catastrophic and can cause sudden shock and death. So it can be very serious. It partly depends on, of course, what the size of the embolism is, so that affects how much of the circulation is being compromised and whether the patient has previously been healthy or if they have underlying heart disease or lung disease already. They're much more susceptible to having very serious consequences when they have a pulmonary embolism. And the reason that pulmonary embolism can be serious is not necessarily just because it's in an artery in the lung, but because it blocks up the circulation from the heart. The heart pumps, the left side of the heart pumps to the body, the right side of the heart pumps only to the lungs. So if you block up some of the major arteries that are going to the lungs, then you've blocked up the majority of the circulation of the heart, and so it can cause a sudden severe strain on the right side of the heart, which is not as thick as the left side, and so it's not prepared to handle heavy loads, and so a large embolism can cause a severe sudden strain on the right side of the heart and can cause sudden heart failure, shock, and even death.
How do you treat a pulmonary embolism?
Pulmonary embolism is treated with blood thinners. There's two types of blood thinners that can be used. The most common type, which is related to heparin and some of the newer heparins, doesn't actually dissolve the clot, but it prevents more clots from forming so that the body itself can use its mechanisms to dissolve the clot. There is a more active treatment called thrombolytic therapy, which actually dissolves the clot. That's more effective, but it also is much riskier. Since it dissolves blood clots, it doesn't only dissolve the clot that's in the lung, it would dissolve any clots that are any place else that are preventing bleeding. So the risk of thrombolytic therapy is that there will be serious bleeding, which can occur in the brain, and so it can cause a severe stroke. About 1 or 2% of the patients who get thrombolytic therapy are at risk for having a bleed in the brain. So we only use the thrombolytic therapy in patients who are actually in shock or having acute heart failure from the pulmonary embolism. In the majority of cases, we give heparin or related type of medication that prevents more blood clots from forming and allows the body's mechanism itself to help dissolve the blood clot, which does take a gradual amount of time, whereas the thrombolytic therapy acts very quickly.
If I've had pulmonary embolism in the past, am I at greater risk for it in the future?
Yes, one of the risks for having pulmonary embolism is if you've ever had it before, or if you've had blood clots in your legs or any place else, then you're at higher risk for having pulmonary embolism. As I mentioned, the highest risk for having a blood clot in your legs is having had recent surgery. Other risks are patients who have cancer are at higher risks for having blood clots, especially if they're receiving chemotherapy. There are some families that have a high incidence of blood clots. And other reasons for being immobilized, for instance, spinal cord injury, where patients aren't moving their legs. And if you're just in the hospital for other medical illnesses, for instance, if you have bad lung disease, you have pneumonia, you have congestive heart failure, you're in the hospital, you're laying in bed, you're not walking around very much, then you're susceptible to getting blood clots. So one of the important things that we've learned in the last few years is that we need to do something in those patients to prevent them from developing blood clots. So if they're having to stay in bed, we very often will give them a blood thinner medication to prevent them from developing blood clots. If for some reason they cannot be given blood thinners, for instance, if they have a susceptibility to bleeding, like they have a bleeding ulcer or other source of bleeding, and they can't be given blood thinners, then we often will use a compression device around the legs, which periodically pumps up and builds up pressure in the legs so that it squeezes the veins in the legs, so keeps the circulation going in the legs so that there's not stasis and development of blood clots. So that's been a big development in the last few years, is that the vast majority of patients who are hospitalized for both surgical and for medical problems often are given blood thinners. The highest risk surgery for developing blood clots is hip or knee surgery. So elderly patients who come in because they fractured a hip and they have to have their hip replaced, or patients who have developed severe arthritis in their knees and they come in and get a knee replacement, those patients are at very high risk for developing blood clots, and nowadays they are all given blood thinners to prevent blood clots from occurring.
Related to what you just said, is there anything that I can do to avoid or prevent pulmonary embolism aside from try not to need surgery that puts me at risk?
Well, obviously staying active and ambulatory and exercising and using your legs is important. There are times when you can't do that. For instance, prolonged airplane travel. It's often recommended that if you're going to be traveling for a long time on an airplane, that you might take aspirin, which would help thin the blood and prevent blood clots. Also, it's important, it's a good idea on a long plane flight to periodically get up and walk around, or you can do some exercises contracting the muscles in your legs to help improve the circulation so that you don't get blood clots.
Very well. Thank you very much for your time, Doctor.
Thank you.